Prospective genetic counseling. So basically, prospective genetic counseling refers to the process of providing information, guidance, support to individuals or couples before conception or early in pregnancy regarding the risk of genetic disorders in their future children. The goal is to help them make informed reproductive choices. So basically, a young couple or a expecting couple, they are counseled about the genetic disorders which can occur in their children. How are they counseled? By providing information. They are guided of taking informed choices. Okay. So these are the objectives. First, there is risk assessment. So we need to evaluate the family history, personal medical history, ethnic backgrounds, and basically these will help us in estimating the likelihood of them having the genetic disorder. So family history, personal medical history or conditions, a background, ethnic background also needs to be evaluated. So basically the first objective is risk assessment of these couples so that we know which disease are more likely to occur in their offsprings. Then second comes education. So we have to explain to them or educate them about the inheritance patterns, like about various diseases like the autosomal dominant diseases, autosomal recessive, X-linked diseases, etc. And we have to inform them about the nature and the prognosis and the management of these potential genetic conditions which can occur. So first is explain the inheritance pattern. Inheritance pattern. And the second is to inform them about the nature, the prognosis of the disease which their child is likely to have. And the third objective is to provide reproductive options. So a person, they should be told or informed about the natural conceptions with prenatal testing. They should also be informed about assisted reproductive methods, which is the IVF, along with pre-implantation genetic testing. So before implanting the fetus, which they have, before implantation of the fetus, the genetic testing of the fetus should also be conducted in the individuals with, who are highly susceptible to impart these diseases into further into their offsprings. Use of donor gametes or adoption should also be told to them as an option, because having offsprings with genetic disorders will only cause more and more problem, both socially, economically, mentally, and physically, to both the child and the parents. Okay, along with this, the fourth objective is to provide them with the psychological support. So see, this telling somebody that the child will get genetic disorders is a big mental burden. So they should be given emotional support. Their anxiety, depression, or any other ethical consideration should also be taken into consideration. We can involve psychiatrists into this so that in order to give an integrated or wholesome delivery to the parents. So these were the four objectives. First, risk assessment, then education, then reproductive options, and lastly, and very important, psychological support in such cases. Coming to the indications. So who needs to undergo this prospective genetic counseling? So firstly, couples with family history of genetic disorders. So if we, as I was saying, that their personal medical history, their family background, ethnic background should be thoroughly checked or evaluated to put it in a better way. So couples with family history of genetic disorders should particularly be given this genetic counseling. Those having consanguineous marriages, if one knows that both the couple are very, very close relatives, so they are also a very eligible couple to get this counseling. The third one is couples who have history of recurrent miscarriages or stillbirths. So for them also, we need to see if any one of them or both of them are suffering from any genetic diseases which leads to these outcomes. Known carriers of genetic mutations. If any of those or both of them are known carriers, they should be very well counseled about that their offspring might also be a carrier or might even present with the disease. Women of advanced maternal age, those who are conceiving at later age in their life, they should be particularly counseled, as with advancing age, the likelihood of having genetic diseases increases. Lastly, individuals with ethnic predispositions to specific genetic disorders. For example, we see sickle cell is common in African population. So ethnic background should also be checked here. So these are the couples or the people who are good, who should be imparted with this prospective genetic counseling. So what is the process of this prospective genetic counseling? So first is collection of a detailed history, as I was saying. So we should know the family pedigree, the past pregnancies outcomes, the ethnic background, any consanguinities there in the family or not. So this should be thoroughly checked. Family pedigree, consanguinity, past pregnancy outcomes. So this detailed history should be collected. Then there is risk assessment and interpretation. So we should determine the carrier status using genetic tests in both the parents, if indicated, and calculate the recurrence risk for specific disorders. So recurrence risk should be calculated. Recurrence risk should be calculated and carrier status should be determined. Okay. Then comes the information delivery. So one should, in prospective genetic counseling, this is a very important part as to explain the risks in a very understandable terms. If the person is not coming from a well-learned family, or the person themselves, they are illiterate, in their local language or the language where they can understand it easily, the information should be delivered to them so that it reaches them. And along with that, they should be informed about the testing options, the limitations of these tests, and the accuracy as well, so that they know what they are getting into. So explain risk in understandable terms and discuss with them the testing options, their accuracy, and implications. Okay. So coming to decision-making support. So here one should help the couple to weigh the risks and the benefits along with their personal values and provide information on prenatal or pre-implantation diagnosis. So pre-implantation diagnosis should be told to them, prenatal and pre-implantation diagnosis, and risk, benefit, and personal value should be weighed so that they can come to a best decisions which is suited for them. Along with this follow-up, so one should offer them especially this genetic counseling offers them referrals to certain specialists if required, and an ongoing support during pregnancy or reproductive planning also becomes very important. So specialist and ongoing support in throughout the entire pregnancy and planning for pregnancy in the future should be is provided in prospective genetic counseling. So here are the key points one should remember, that the entire process of this prospective genetic counseling should be voluntary and not directive. So one should not make the decision for the couple. The couple should be informed about all the pros and cons of various things, the diseases and the tests and the pre-implantation tests and everything, and they should come up with their own decision. So the counselor provides information and support, but does not make decision for the couple. Okay. Ethical considerations. So one should respect the autonomy, confidentiality, and the cultural beliefs of the people. So they should be educated and educated about all these things, the diseases which they might pass on to their children or their future offsprings. But one should maintain the autonomy of these people, and the cultural beliefs should also be preserved. Again, so basically the goal is to empower individuals to make informed reproductive choices and to reduce the risk of genetic disorders. So once again, the motive of this genetic counseling, the prospective genetic counseling, is not to impose certain beliefs or certain things on people, but the crux of this counseling is to make them understand and help them take an informed reproductive choice or informed reproductive decision based on their understanding of all the pros and cons.